Diabetic socks, and what are the good features of diabetic socks? Now, for those of you who don't know, there's actually socks that are specifically designed for diabetic patients to help them limit infection and to stop any constriction around any swollen ankles or ankle joints. So the features that we look for in a diabetic sock really help to limit infection and stop constriction around the ankles. And the reason we need to limit infection is because diabetics have a much higher rate of infection and amputation when compared to the general population. And this is because when we have diabetes, the diabetes causes the blood vessels and the nerves to be killed off when the blood sugars go too high or too low. And so if the diabetic foot doesn't feel very well and it doesn't heal very well. So it sets up this perfect situation where if we get an infection in a diabetic foot, we're more likely to have an amputation. So the sock features we need to look for are anything that can help to reduce irritation and damage to the foot is a great feature in a diabetic sock. So the first thing we look for is, does the sock have flat seams? So if we have a look at the toe section of this sock, there's no seam on the outside, and then if we turn it inside out, we'll see that there's actually the seam on the inside, if we can see in the camera, is nice and flat as well. So there's nothing in this sock that will actually irritate the toe. The second thing we look for, and it's actually easy if we leave this one inside out, we've got this really nice thick padded or densely padded section under the foot here. So what this helps to do is helps to limit any pressure on the bottom of the foot, just like putting a soft insole under the foot would do. Putting a padded section in our socks will help us to limit the pressure under the foot, and then we're less likely to get pressure sores and ulceration. The other thing this sock's got, it's got this Y-shaped seam in the heel. You can see this goes up and then splits into two. So what that helps to do is it helps to cup the heel, so the sock will actually sit around the heel and actually match the shape of the heel more so than if we didn't have that Y shape in the heel. And it just means that the sock won't bunch up around the heel, and it helps to really match the shape of the heel, so we won't get any irritation from sock bunching or any little knots or knobbles or anything in the sock. The third thing we've got, now this sock's really quite a special one. We've got a non-binding upper, so there's no seam in the top there. So when we actually put this on a leg, if the leg swells, this will actually give with the leg. So it won't actually bind, and often what diabetic patients find is that when their socks have a cuff at the top, they get this big ring or indentation around where the swelling is at the tops of their legs. So this will help to limit that. The other features of this diabetic sock is it's got a fibre in it, made from a fibre called silver mesh. So it's actually got silver particles lined in the actual fibre of the sock. And what the silver particles do is they actually help to promote normal bacterial growth to a normal level, but not over and above. So we're less likely to get bacterial infections and foot odour when we wear the socks with the silver mesh in them. There's a few little basic points on the sock that just help with, because with diabetics often we get eye damage and our eyesight starts to fade as well. So we've got these little markings. So if you have two diabetics in the family, we've got these little size markings where they say medium, for, you might have small, medium, and large member in the family. So they're much easier to match up after the wash if you're both wearing a white sock. So that is pretty much it with the Ergonix diabetic socks. They're the silver mesh, silver iron lined socks with a flat seam, Y-shaped heel, padded foot area, and a non-constricting upper. And they'll just help to limit infection and any problems you might be getting with diabetes related to friction or pressure in the feet. I hope this has helped clear up some questions. Thank you. If you enjoyed this video, please like and subscribe to our channel. It's very simple to do and it really does help us out. If you need further information on the topics discussed, please follow the links in the description, and that will take you to our website where we've got more information on these topics. If you have a specific question that you'd like to ask, please comment in the comments section below, and we'll do our best to make a video to address your question. If you have any further comments or questions, you can find us at ergonix.com.au, and we look forward to seeing you in the next video.